Okay, folks are still hopping on, but I think we're going to go ahead and get started since it's just after 12, and I want to be respectful of everybody's time today. Thank you everybody for coming. This is our first in an inaugural series of webinars put on by the Reentry Subcommittee of our Criminal Justice Advisory Board. And today we're joined by Probation Director Chad Libby and Probation Services Quality Assurance Supervisor Meredith Zurin to talk about, give a high-level overview of the justice system as a whole, and also learn a little bit more about reentry, evidence-based practices, and how those impact our system. So a few quick announcements before we dive into the presentation. Please mute yourself during the presentation, if you would. And throughout, this will be recorded. We will be posting the presentation at a later date. We're going to be able to put it on YouTube as well as post it to the county website so folks can view it at a later time. So please keep yourself muted throughout the presentation. At the end, we will have time for questions. As we're proceeding through the slides, there's a chat feature. If you're on a computer, you can see a chat feature. Type your question in there and pose it to us. We'll make sure to answer those. In reviewing the registrations, we didn't have pre-submitted questions. We do want to make sure there's time at the end so folks can have anything that comes up during the presentation you want to talk about more. We're going to have time at the end to go through the chats and make sure that we're answering those questions for you. And again, just a reminder that this will be recorded throughout. So with no further ado, we'll go ahead and continue and get started. So why are we here today? Talked a little bit about some of the goals of why we put together this webinar. We heard very clearly from members of the community that they weren't always sure of the changes in our system, how the county goes about working with criminal justice populations, some of the initiatives that are important to us as stakeholders in the system, and certainly things that are important to folks in the community impacted by our work. So we set about to put out a survey and say, what do you want to hear from us about? And then, with all the issues that happened with COVID, we were planning to have a symposium addressing the results of that survey. But again, with COVID, we couldn't take the risk of having all those folks in a room together in a symposium. So with the new technology of these web conferences, we were able to put together this webinar, break it down some of the topics that people wanted to hear about, and then have these every other month, and hopefully kind of build that connection to people in the community and to our providers, so that if they have questions, we can try to put together a series or a topical discussion on that issue. So we're going to talk about the goals and priorities of the system. As we've been working on them, we'll hear a little bit about our strategic planning, stepping up initiative, some of the goals that have come about as part of that. You're going to hear some of the initiatives we've undertaken, including some grant applications and some other projects that tie into those goals. And at a very high level, we're going to discuss a little bit about evidence-based practices, what they are, and why they matter as part of carrying out those goals. So these webinar series, again, we hope to have them every other month. The next set, I have the dates up here to review. The dates are subject to change, but we're trying to keep them to like the third Thursday of the month during a lunch hour, so kind of like a lunch and learn kind of format. But these are, again, the topics that were selected by members in the community. We prioritized them based on the responses, and so we spaced them out every other month. So if you're interested in any of those and you've signed up for this one, I'll be sure to send out notices of those upcoming sessions to you as we're planning them, so you have that date and time. And again, know that we'll be recording all of these and posting them, so we'll have them available for review at a later date if you would like to watch one and were unable to on the day that it aired. So a little bit about our Criminal Justice Advisory Board. Near and dear to my heart, I'm the Criminal Justice Advisory Board Administrator. But this body in Dauphin County is almost 20 years old. Depending what dates you look at, you could actually say it's 20 years old. Way back in 2000, there was a kind of ad hoc policy board that sort of got together and started looking at how the system was functioning in the county, what changes maybe they wanted to make. A lot of counties around that time in the very early 2000s were trying to come up with a better way to collaborate together, multidisciplinary, kind of looking at, who are our human services partners, who are members in the community that we need. How do we, department to department, how does something that the sheriff's office does impact the DA's office? Or how does something the jail does impact probation? So those were the kinds of things that CJABs were designed to tackle. And our board was formally, bylaws were approved in 2003. And we came up with the following mission statement. Obviously, mission of the CJAB is to enhance the criminal justice system and public safety through a collaborative and targeted approach, which prioritizes the support of evidence-based practices and innovative strategies while maintaining fiscal responsibility and maximizing outside resources. So that sounds great, right? But what does it all mean? You really have to break it down, and that's sort of what we'll do today. The chairman of our CJAB is the district attorney. Prior to our current district attorney, Fran Chardo, Ed Marsico, who is now one of our judges, he was the chair from the inception until about 3 years ago. He was the chair of CJAB, and through that time, we entered into any number of planning processes, grant applications, all with this bend towards addressing needs in our system and trying to do it in such a way that we're able to make an impact in the area we're focusing on. So if we say we have individuals and we notice that there are challenges with an individual with a mental health diagnosis coming through the system, we see there's a challenge with those cases, we want to study that and try to figure out a way to maybe make a program change or a process change to improve the overall functioning of the system, and look at the stakeholders and see how they work and what they do. So an idea of how this is organized. I hope this isn't too difficult to see, but we have several subcommittees. Again, we are an advisory entity. We're not some counties have a policy. They actually can promote and the policies. We're advisory, so we'll based on all of our collective knowledge and work, we'll advise the county and work together to say this is probably a good direction for us to go. These are changes we can implement. Again, driven by department heads, criminal justice staff, and you can see that ultimately we report to the county commissioners and the president judge. The district attorney is the chair. And we have several subcommittees. One, the reentry subcommittee, is part of why we're here today. The HOPE Collaborative stands for the Heroin Overdose Prevention and Education Initiative. It's a group of individuals that look at overdose rates. We look at ways we can reduce stigma in general for addiction. The Data Committee, we have any number of systems that we use throughout our county and our justice process. So we try to make sure that our staff take seriously understanding what's in their systems and how it can be used. Because if we have that data, if we have that information available, we can then start to say, okay, these are the actual, numerical results of or changes to what we're looking at, and are things improving? So the Data Committee kind of focuses on those things. Stepping Up Committee, you'll hear a little bit more about the Stepping Up initiative later. They focus on a Stepping Up report, which in a nutshell looks at individuals with severe mental health diagnoses and how those individuals come through our system. There are key points that their goals are looking to reduce jail bookings, length of stay, recidivism, and improve connection to services. So they're looking at how the system functions, our local system functions in those areas. And then there's the bail review kind of assessment team, where we're looking at very much at the front end, what's happening at that front end related to what we're doing, you know, with bail, with pre-screening at the front end. And that's a little bit more of an ad hoc subcommittee. But that's the overall goals. And then you'll see some of these other ones that sort of pull together as sort of work groups as part of this structure. So I hope that helps kind of clarify how everything is structured on there. Our membership, like I said, we're all of the different county agencies. We have prison warden, we have work release, we have human services, drugs and alcohol, mental health, we have district attorney's office, public defenders. As many folks can be involved, we encourage to become involved so that we can make sure as a county we're working very well together. Some of our strategic goals for the most recent term involved looking at the front end of the system. So one of those goals was, you know, doing bail review. Another was screening and assessment, making sure we're able to improve an identification of individuals at the front end. Engaging state resources, continuing to work with our partners in those areas. Working on the Stepping Up initiative, and making sure that folks are trained and engaged in at all levels of our system, that we're doing enough outreach to the public so people know that they can get assistance if they need it, and that we are interested in feedback and learning more from the community in how we operate and what we can do. So with that, I'm going to turn it over to Chad Libby. You're going to hear a little bit from him, and I'll see you. And well, I guess you'll hear from me on some later slides. So Chad, go right ahead. Take it away.
Well, good afternoon, everyone. I want to thank you all for taking the time this afternoon to participate in our first webinar. I also want to personally thank Catherine for her leadership in organizing this webinar. A lot of work behind the scenes to get this up and running, so thank you, Catherine. So what is reentry? You know, as you look at the traditional meaning of reentry, it really looks at the transition from life in jail or prison to life in the community. But as we know through experience, we'll talk a little bit later, that definition has really expanded in terms of reentry. But so as you can know, as most of you know, and some can imagine, this transition can have a profound implications for public safety, and that's really an important factor when we look at reentry. But as we go on, I mean, some of the important things we really need to know about reentry. You know, upon reentering society, former offenders are likely to struggle with substance abuse, lack of adequate education and job skills, limited housing options, as well as mental health issues. And we talked about Stepping Up initiative, and we'll elaborate a little bit on that a little later. Also, statistics reveal that most reentrants will return to prison or jail within the first 3 years of release. As well as most criminal, and this is really important about reentry and the purpose of this webinar and communicating what we're doing in Dauphin County, is that most criminal justice practitioners, agencies, and community and faith-based providers do not have the resources to provide every adult leaving prison or jail with the services they need to reduce their likelihood of reoffending. The process of reentry is hindered by a lack of treatment services available to offenders before release from incarceration. So again, this is why we're here today, really to emphasize the challenges faced by offenders as they return and the impact of their return on families, victims, and communities. And it's very critical because, you know, this really is important when it comes to addressing public safety. Without resources, our reentrants will continue to have difficulties reintegrating back in the community. All right, so let's talk a little bit about our goals of our reentry committee. You know, we talk improving the outcome for offenders currently involved in the county criminal justice system. We're looking at prevent further penetration into the justice system, as well as reduce recidivism. Use of fiscal and other resources wisely by reserving the most restrictive setting jail for those who present serious risk to public safety, as well as begin early identification of at-risk individuals to link them with services and support. So when we look at these goals, these are some of the things we've learned through the implementation. And this is really important when I talk about the traditional definition of reentry, is really what we learned is reentry starts at the time of the arrest, all right? It doesn't start when they leave jail or prison. Really, it starts on the onset of an arrest. Being able to assess them immediately to address risk factors that are predictive of reoffending, and we'll talk a little bit about those later. Also, accessing treatment and interventions to reduce these risk factors as early as possible. So this is really really important from our reentry goals. We've learned a lot the last few years, and it's really important as it relates to key stakeholders such as you participating in this webinar, that reentry, to me, it's like it takes a village to really help us be successful with each and every reentry that's coming into our community. That said, I think this is a perfect segue into Meredith, our next speaker, and how our system has changed to address some of these barriers of reentry. Meredith?
Thank you, Chad. I'm very excited to be able to share the great work that has been going on here in Dauphin County. So with that being said, how many of you have heard or are familiar with the sequential intercept model? The sequential intercept model was developed over several years, beginning in the 2000s. The model was developed as a conceptual model to inform community-based responses to involvement of people with mental and substance abuse disorders in the criminal justice system. The sequential intercept model is a framework to provide the criminal justice system a visual of key points in the justice system processes. The sequential intercept model is most effective when used as a community strategic planning tool to assess available resources, determine gaps in services, and plan for community change. These activities are best accomplished by a team of stakeholders that cross over multiple systems, including mental health, substance abuse, law enforcement, pretrial services, courts, jails, community corrections, housing, health, social services, people that have lived the experience, family members, and any other key members. Using the sequential intercept model, we are able to see our justice system and where interventions or programming can be used in order to prevent an individual from entering the system ever again, and setting them up to succeed with the needed resources so that they are able to sustain themselves in life. I'm going to go over these intercepts and how Dauphin County is utilizing these intercepts. I also, as discussed earlier, want to highlight another important initiative that Dauphin County eagerly had the opportunity to participate in. In December of 2016, Dauphin County began a project with the National Stepping Up Initiative. The overall purpose of this project was to reduce the number of people with mental illness and co-occurring substance use disorder in prison. The National Stepping Up Initiative allowed us to look at our data and see where we could make changes. The overall purpose was to reduce the number of people with mental illness in jails. So with that being said, we're going to talk about Intercept Zero, community service. Crisis response models provide short-term help to individuals who are experiencing mental or substance use crisis and can divert individuals from the criminal justice system. So with that being said, we're going to talk about law enforcement treatment initiative that's going on here in Dauphin County, and we refer to it as LETI. This process allows for our county to enhance the capacity of local treatment services systems by ensuring law enforcement, when encountering a person who might otherwise be charged with certain drug-related offenses, can expect an immediate response from a certified professional for additional assessment. LETI has allowed for increased local awareness of the availability of treatment, improves commitment of stakeholders to ensure that those who need treatment receive it. The justice system is working to guarantee, when possible, that those who might receive charges have an opportunity to avoid the impact of a criminal record by doing the right thing and getting the help that they need. We're also going to go to Intercept 1, which is law enforcement. So police officers can learn how to interact with individuals experiencing crisis in ways that promote engagement in treatment and build partnerships between law enforcement and community. One of the things that's going on here in Dauphin County that came from the Stepping Up initiative is crisis intervention team trained officers. This team bridges the gap between police response and mental health care by forming a partnership with behavioral health and human service professionals, consumers, their families, and law enforcement. CIT is designed to educate police officers on effective interaction with individuals who may be in crisis and/or consumers of the mental health system. This is a 40-hour, week-long training that police officers, probation officers, judicial center staff, prison guards, and any other staff are encouraged to participate in. The training teaches de-escalation techniques when encountering individuals in the field with severe mental health diagnosis. The co-responders team model is a product from the Stepping Up initiative as well. The co-responder team model ensures police have assistance in the field to connect individuals with whom they have contact with and who exhibit signs of mental health diagnosis and/or substance use issues to the appropriate services. Currently, there are 4 police departments are participating in the program: Harrisburg City, Lower Paxton, Swatara, and Susquehanna Township. The police departments were determined based on call volume to EMS for assistance with mental health related concerns. Harrisburg has a designated co-responder who started in April of 2020. Lower Paxton, Swatara, and Susquehanna have a co-responder who began in the middle of May of 20 to assist as needed. EMS also has a list of all those who have completed the CIT training, and they can be called on when a behavioral health crisis is occurring. Intercept 2. Initial detention and initial court hearings. Screening for mental health and substance use disorders when an individual is arrested. Brief screens can be administered by non-clinical staff at the booking or judicial center prior to their first appearance. Here you'll see opiate court. We're hoping to have this up and running in early of 2021. This court will work with individuals who have an opiate dependency and will work on providing intensive options for these individuals. We have a pre-trial risk assessment, also known as the Allegheny Risk Screening Tool. This is a screening tool that is done at the time of arrest and used to assist magisterial district judges in setting bail recommendations. The tool focuses on failure to appear for further court hearings and looks at the likelihood of rearrest. We also, as Catherine stated earlier, we have a bail review team. This team identifies cases to review based on bail characteristics, including type of bail, if the person is on or off of probation, and even looking at the risk need information when it is available. This team meets weekly and is comprised of prison staff, the district attorney's office, the public defender's office, drugs and alcohol, and probation services. We also have the DUI Repeat Offender Program, also known as the DROP program. The DUI Repeat Offender Program was an initiative of the district attorney's office in collaboration with pretrial courts and other agencies to ensure those individuals who have 2 or more DUIs receive additional monitoring on their case as soon as possible after the charges have been filed. A SCRAM, also known as a Secure Continuous Remote Alcohol Monitor device, is used to detect alcohol consumption. At DROP hearings, a representative from drugs and alcohol is present so that the individual can be connected to treatment immediately. Again, we're trying to get people connected with services as soon as possible. We also have Team MESA, which has derived from the Stepping Up initiative. This process allows for case planning for those who are incarcerated in Dauphin County Prison with a severe mental illness and/or co-occurring substance use disorder. Weekly team meetings are held for case planning on these individuals involved. Involved team members include prison staff, probation, Dauphin County Case Management, District Attorney's Office, and the Public Defender's Office. We also have diversion specialists completing screenings at the booking center or the judicial center. This is a process that the Dauphin County Booking Center staff complete. They are also known as diversion specialists, and they assist individuals in the center for mental health or drug and alcohol needs. The diversion specialists are using validated risk screeners for mental illness and substance abuse disorders. The overall objective is to immediately link an individual with any services that are needed. We're going to go to Intercept 3, jails and courts. Treatment courts are for high-risk, high-need individuals. Here in Dauphin County, we have drug court and veterans court. We also have a jail-based intensive outpatient program with Mazzetti and Sullivan. I'm going to let Catherine Kilgore, our CJAB administrator, talk about these specialty courts.
Thank you, Meredith. We've had a drug court here in Dauphin County since approximately July 1st of 2008, and Veterans Court since January of 2012. And the model for drug courts, problem-solving courts, treatment courts, you'll hear these terms almost interchangeably used, but it derives from an initiative in Miami in the late 80s. Their criminal justice system was looking for a better way to work together, and they found individuals who had kind of complex behavioral health needs, specifically these severe substance use disorders, had any number of needs that required attention by more than simply a court system could provide. So they needed housing, they needed employment and training, they needed, first and foremost, of course, recovery and treatment, but they needed all of these things. And without some of these, stabilizing factors or programs in place, it seemed like they would cycle through or come back into the system more often. And what Miami found was that when they came to the table, they had someone there from housing, they had human services, they had the attorneys, the judge, they had people at the table reviewing cases for individuals who were likely to come back into the system, who had these high needs, who had these substance use disorders that were quite severe. It worked better. And as part of that, they had individuals report to court at a higher rate than maybe someone under a regular supervision schedule. So in a treatment court, when someone is placed, they're coming to court, at least initially, almost every week. The judge is checking in with them, making sure that they are connecting to their treatment providers, that they're beginning to reach out and talk with their probation officer. The judge is making sure that the participant knows that the court team is available to help, that we are invested in making sure that you succeed. And that dynamic is what sets the treatment courts apart from a regular case coming through our justice system. We have in Dauphin County in any given year almost 7,000 dockets that come through our system. That represents typically about 5,000 people. So roughly 5,000 people come through our system every year. And each one has a different set of needs. We'll talk a little bit more later. Director Libby will talk a little more later about what risk and needs are and what that means. But some individuals, the ones most likely to come back to us, have been through the system multiple times. And if there's a treatment need, specifically a drug and alcohol need, we have the drug court program. In July of 2018, through funding from PCCD, we were able to work and create a DUI track of our treatment court. This coincided with a program Meredith talked about earlier, the DROP program. And so as we're identifying individuals in DROP, if there is a need, if drugs and alcohol identifies a need and the person is willing, we're identifying those cases faster and able to link them into then kind of a stabilization program, which a court you could think of it as kind of a stabilization for that person, and able to have that option available, breaking out the needs of DUI offenders specifically, because they are a little bit different than your typical drug court offender, just on some of the attitudinal beliefs, that sort of thing. So these programs are designed to offer intensive treatment, intensive court supervision and reporting, and really as much support as we can provide to move the person forward. Veterans Court is very similar, except the first criteria is, have you served your country? In both programs, you will find individuals who have been through the system many times, who have complex substance use disorder and often mental health needs. But for veterans, they have served. So within that structure, we look at that first. Do they qualify as, have they served their country? Have they received an honorable discharge? And they are screened by our Veterans Justice Outreach Specialist at the Lebanon VA. So he will do that screening, and then we're able to potentially place them in to the court. Similar structure, you're meeting in front of the judge each week, at least initially. The whole team is working with you. You have a very intensive probation schedule. And some of the benefits to the court, especially the stabilization, but many times individuals coming into these programs will be able to offer them some sentence benefits, either reduction in jail time, sometime reduction in charges. And also, there can be some financial benefits in the treatment court programs. Through some grants we have, we are able to fund and pay for treatment. Maybe the person doesn't have insurance, they don't have Medicaid. First and foremost, we're going to try to get them onto Medicaid. But if there isn't, if there isn't money available, we have grants to offer to pay for treatment. So we try to remove all of the barriers we can, transportation otherwise, with some of the funding we have through grants like from PCCD, PA Commission on Crime and Delinquency, the Administrative Office of Pennsylvania Courts, AOPC, and even some federal funds that we've had in the past. So we work to remove those barriers. We make sure that if a fine or fee is assessed, it's the lowest rate possible. We cover drug testing. We make sure that the person can truly and fully focus on engaging in treatment, and through engaging in treatment and engaging with our officers and talking with the judge and being there in court, can get to a stage of recovery. So it's a very intensive process. It's also a really key part of stabilizing individuals who need that more intense look and might need that longer period of time to stabilize and settle into a new path forward. So Meredith, I'll turn it back over to you with that.
All right, thank you. So also we're going to talk about our jail-based intensive outpatient program with Mazzetti and Sullivan. Mazzetti and Sullivan is a treatment program for incarcerated and offenders. Individuals who are incarcerated are evaluated and participate in treatment while incarcerated. The referral to this program can be done as a self-referral. Prison staff can do a referral. Probation officers can do a referral. And courts can do a referral. It's based off of a continuum of care model. So upon an individual's release from incarceration, Mazzetti and Sullivan will then continue outpatient services with this individual. All right, Intercept 4, reentry. Transition planning by jail and in-reach providers working on warm handoffs. So in this, coordination with reentry service organizations. An example of this would be the Capital Region Ex-Offender Support Coalition. They are a local organization that supports reentry and engaging the community. Catherine, I'm going to let you talk a little bit more about some of our upcoming grant opportunities with this.
Yes, we just received a grant from PCCD, again, PA Commission on Crime and Delinquency, to help us work collaboratively with CRESIC a bit more, kind of redefine our roles as a coalition to support our ex-offenders. So what that means is over the course of the coming year, we'll be able to engage with a consultant who's helped strengthen coalitions around the state and really give us some in-depth planning of how CRESIC as an entity and sort of the county, how they work together, how our CJAB members work together with them, how our county can coordinate, how we can work together, really. And it's going to be a pretty intensive process. It's starting in 2021. At the end of that, we'll be culminating in more of a more in-depth summary of the process overall, and put together an updated strategic plan in areas of reentry. So that is coming up. with Pre-6 specifically. I did want to mention that because that will be the basis for some of our plans as a CJAB moving into the future. So as much as we're focusing on the front end with our current strategic plan, we're making sure to, you know, readdress and make sure that we have the best operating relationships with folks in the community. And this is one way we're doing that.
All right, let's talk about the Dauphin County Work Release Center. They're working, when an individual is in the Work Release Center, while they're there, they're also working on treatment services to individuals. Types of treatment services that can be offered are family reunification, housing, drug and alcohol and treatment, employment, mentoring, and connections to other services that the individual may need. Probation services, we continue to work on the implementation of evidence-based practices. As many people know, we do complete an ORAS, which is a risk need assessment, and we do that so that we're able to identify an individual's risk and the needs that are established for case planning purposes. With the use of the ORAS, caseloads have decreased, allowing officers to focus on offenders or individuals who are at more moderate, high risk, high need. Cognitive behavioral therapies are offered to moderate, high risk individuals. Currently, probation services is getting ready to have all their officers trained in motivational interviewing. MI training will define the framework of motivational interviewing and define the key characteristics on how to lower resistance and increase motivation for engagement into programming. The emphasis is on foundational skill development and engagement and creating a collaborative relationship with the individual and the parole officer. We also have a severe mental health case reentry coordinator. This position started in March and was a recommendation of the Stepping Up initiative. This coordinator is working to ensure that there are case plans for sentenced individuals transitioning into the community who have been identified at DCP as having a serious mental health illness or serious co-occurring disorder. This ensures individuals leaving the prison have case management, services, medication, all set up before they leave. Medications have always been provided, but the linkage with case planning with probation officers and into the community is new. Intercept 5, community corrections. Access to recovery supports, benefits, housing, and competitive employment is paramount for justice-involved individuals. As stated before, probation services completes an ORAS or community supervision tool. This allows us to identify the individual's needs and develop a case plan with the individual's input for case planning. The assessment also allows us to identify who we target, what we target, and how we target. The assessment also identifies barriers this individual may have so that we can remove them before getting them involved into a program, therefore increasing their likelihood for change. The Director of Probation Services, Chad, will talk more in depth about risk-need-responsivity and evidence-based practices. Probation Services also has specialized caseloads or units broken down by risk-need scores and zip codes. We have a mental health unit that's comprised of 3 probation officers. We have a sex offender unit that's comprised of 4 probation officers. We have our specialty court officers, which in total between drug court and vet court is 3. We have street crimes unit. We have an intensive drug unit. We have an electronic monitoring unit. We have the ARD unit. We have the monetary compliance unit, and we have an upper county unit, along with our generalized caseloads. In total, we have 73 probation officers. And last year alone, we supervised over 6,800 individuals on county supervision. So before we move on, I was just wondering if anybody had any questions, or if Catherine or Chad, if you guys wanted to add anything that I may have missed.
No, I think you did a good job hitting all the key points.
I believe I believe so as well. And again, if anybody does have questions, please make sure to put them in the chat and we'll definitely address them. I did want to make one point. We talked about the Law Enforcement Treatment Initiative a little bit earlier. One other grant we've recently received from the PA Commission on Crime and Delinquency will allow the District Attorney's Office to have an attorney assigned in our office that really focuses in on the behavioral health cases. And that position ties really to Letty, to the planned opiate court, and some of these other new initiatives we've had in the recent years. As you can see from the intercepts, we've done quite a bit of work looking at specialized populations and individuals that might have more complex needs. And we wanted to make sure that our office also had a district attorney that was completely focused on cases like this and working with programs in this area. So that's the only other point I would make. Thank you very much, Meredith.
Okay, I guess we are moving on to the next section of evidence-based practices. As you know, or otherwise EBP, this language really came into the Pennsylvania criminal justice system in 2010 as part of the Juvenile Justice System Enhancement Strategy. I was part of that initiative back then, and then in about end of 2013, evidence-based practice started to really kick off in the adult system within Pennsylvania. So what is evidence-based practices? Well, basically, and simply put, it's described as findings from empirically sound social science research. Its movement has its origins in the field of medicine, where an initial interest in the safety of treatment was eventually joined by an equal interest in the efficacy of treatment. So in order to receive a label of evidence-based practices, there must be a multiple methodological rigorous studies with heterogeneous or intended, for example, female offenders populations in different locations, which show consistent positive results toward goals the practice or program was set to achieve. Several key components of scientific evidence that are really important to note is objective, is observable by others, is based on facts rather than thoughts or opinion. That's really, really important. And it is free of bias or prejudice that might be caused by personal feelings. Replicable. It can be observed by others using the same methods that were used to produce the original evidence. And lastly, generalizable. It can be applied to individuals and groups other than those who were involved in producing the original evidence. So they're really important key components of scientific evidence. And one of the recognized bodies that provides such a label of evidence-based practice in the criminal justice system is the National Institute of Justice. So most programs, get that label through the National Institute of Justice. They are really the recognized body for EBP. It truly, in terms of policy and practices, it focuses on reducing offender risk, which in turn, if done well, reduces new crime and improves public safety. Again, basically in the business world, it really truly is the gold standard of policy and practice, therefore in a criminal justice system. Now, in an effort to reduce recidivism as it relates to evidence-based practice, there's 8 core principles that are associated with the reduction of recidivism, and if done well, you'll achieve that reduction. One is the use of risk assessments, and we'll talk a little bit about that. Meredith mentioned the ORAS, as well as the Allegheny tool for pretrial. 2 is need to enhance motivation. That's where we use motivational interviewing. 3 is targeted interventions. 4, really important, matching offenders' traits with intervention. 5, use of cognitive behavior programming, therapy. 6, strengthening pro-social influences. 7, adhering to program principles. That's the fidelity model. And then 8, we talked a little bit about this, but use of data to guide action. Data collection is very, very important. So some would say, why does this matter? Well, historically, and I've been, in this line of work since '89, Dauphin County since 1998, most programs honestly spit out anecdotally how well their programs perform. However, they had no data or outcomes to support their claim. Also, if you look at what we've experienced really early on in the 2000s is that if you say your program reduces crime, can you explain a little bit of how you're able to do that? And we see that it was a struggle early on with programs. For example, if you say, drug use is reduced with substance abuse disorder individuals, well, how do you know that? What curriculums are you using? Are you using a cognitive behavior type program curriculum that's validated and given that evidence-based practice label? Is it done with fidelity as it relates to dosage, the quality of delivery? And then model of the therapy shown through studies has that impact of reducing use. So that's what's really, really important about evidence-based practices and what we've experienced. But I will say that through the last 5 to 6 years, we're seeing better results with programming through a lot of validated programs and certification type programs that come in. For example, the Standardized Program Evaluation Protocol, which is a very thorough, rigorous validation of programs within the juvenile justice system. That's really, really important, and it's able to identify, are you hitting the right target population, or you're providing the doses based on research, those type of things. So with that said, are you targeting the right offender? What we have found out, again, through the juvenile justice system, as well as the adult system early on, is that programs were really, we found a lot of low-risk offenders were involved in programming that associated with modern high-risk offenders. And what the research says is low-risk offenders have a low probability of reoffending. Most of them are self-correcting. However, modern high-risk offenders, they're the ones that you want to concentrate your resources on. They're the individuals that require treatment, intervention, monitoring. But if you have low risk interact with modern high risk, the likelihood of that low risk staying out of future crime unfortunately is compromised, and that's really important. So what does the science say about modern high risk offenders? Well, dosage wise, modern offenders require up to 200 hours of treatment interventions. Now think about that, up to 200 hours of intervention. That's very hard to accomplish with if you have lack of resources in the community that are evidence-based to provide those programs. A lot of it's going to be around cognitive behavior programs, skill building, those type of things. Then when you reach the high-risk population, they need up to 300 hours of intervention and treatment. So you can understand the purpose of this webinar and what the goals and objectives of CJAB and REENTRY are, is really aligning services and programs with the with our community, within our community, to really target those modern high risk with the ultimate goal of reducing their likelihood to commit another crime. So let's talk a little bit about risk needs assessments. I like to call it Risk-Needs-Responsivity, R&R, and the R is the responsivity part of it as you use third and fourth generation tools. So risk needs helps us determine the problem that's going on with that individual that's coming into our system. So we use that risk needs to identify that problem. The methods, if you look at it from a clinical and actuarial, let's use an analogy. You do a doctor's visit, you have an ailment, and Sudafed it is, the doctor prescribes. Well, is Sudafed suitable to treat all ailments and diseases? No. That's not one approach should be taken to treat all offenders, and that's what you kind of see in the past. Also, another analogy is pay your doctor bill. What service are you paying for? Well, you receive the invoice and see what the doctor did for you. Well, that provides you that framework assessment, almost in in association of a diagnostic test. The result of that diagnostic test really provides us a guide in terms of developing a case plan. What contemporary research indicates that actuarial assessments provide better results than clinical judgment alone. Why? Well, again, it's removing individual bias and opinions, again, leads to results that are more consistent and ideally to a greater predictability of future criminal behavior. So if you look at most assessments, tools have similar predictive accuracies, in part because of consensus about the core risks and need factors that best predict future offending. What are some of those? Well, the top four, we look at antisocial attitudes, antisocial peers and associations, antisocial personality behavior, patterns, and then history of antisocial behavior. And then what you'll see in these third and fourth generation tools is an additional 4 or 5 additional risk factors that are predictive in future offending. And they are, some of the examples are family, marital, school and work, use of leisure time, and then substance abuse. So let's, as we move forward to, in the spite of time, look at the risk-needs-responsivity model. So the first is risk. What's really, really important about these 3 principles is risk is first. You're really matching the level of service to the risk of reoffend. So for a low-risk offender, as you heard me say, a lot of them are self-correcting. So you might have some skill-building type interventions, maybe to help with job building, problem solving, those type of things, but you're not really going to provide rigorous programming for a low-risk offender. So risk principle really identifies who to target, the level of supervision and treatment that matches an offender's likelihood of reoffending. Higher risk cases require more intervention, structure, supervision, and resources. And focusing supervision and treatment resources on lower risk offenders can lead to wasted resources, and in some cases, may actually increase recidivism. So let's talk about the importance of the needs principle. Really, the needs stresses the offender's criminogenic needs. So when we talk about needs, we're talking about the criminogenic needs that research has shown those risk factors, if not addressed, that individual most likely will continue to reoffend. We look at what those needs are to be addressed, where need exists, and target with treatment and interventions. And the needs principle looks at dynamic and static factors. As you know, dynamic factors, these are factors that can change. If you're in a domestic, a relationship with a paramour who's, maybe, abusive verbally, can you change that situation? Yes, it's difficult, but you can change it. Or static factors like age at first arrest, which are very predictive of future crime, you can't change that factor. And again, factors most strongly associated in the needs principle, as we talked about, is anti-attitudes, antisocial peers, personality, and behavior. And the additional risk factors that I talked about with family and marital, education, employment, and lack of pro-social recreational activities is very important. And then we move on to the responsivity factor principle. It's really, that is important for us and when it comes to intervention. It's really looking at treatment interventions that should be tailored to the offender's learning style, motivation, developmental stage, and cognitive ability. So a couple examples of responsivity factors. If you have an individual who speaks very little English and you send them to a program and where they have really no translator or anybody that has the ability to speak Spanish, they're going to struggle with being successful with that intervention. You're looking at child care, transportation, you're ordered to treatment. Well, if it's 10 miles away, if you have no vehicle to get there or public transportation, that becomes an issue. Or if you're low functioning. So these are examples of some of the responsivity principles that we have to be mindful of. So treatment intervention most effective in reducing recidivism, you heard me say this before, is cognitive behavior programming. So this really truly addresses the question on how, to target offenders to ensure a successful intervention. With that said, I just want to make sure I hit all the other items. I'll leave you with this. This is a really good analogy that I try to use. If it relates to medical. So really, when you look at risk-needs-responsivity, is you have an individual with an unknown ailment. Well, that unknown ailment is what we're talking about here, is that criminal activity. The criminal activity that was done is the ailment. So what do we typically do? We need to examine and test that ailment, find out what it is. That's where the risk-needs-responsivity assessment comes in, and then the findings of that assessment. There we'll look at the risk level and the needs. And then we look at, once we look at that risk level and needs, then we're looking at the prescription and or treatment recommendations. Again, what we're targeting, those criminogenic needs that we're targeting. So when you go to a doctor, you have these ailments, they give you these recommendations. Most people have no problems following them or signing up. All right, I need surgery, I'll do surgery. But unfortunately, it's not the same way in the criminal justice system when you're doing these risk needs assessment, is that it really requires the individual to be honest, and we have methods within these assessments to gauge that. But it really getting that individual to follow the treatment plan, follow the targeted intervention programs that are provided, that can be provided to them, and that's where our challenge lies. So when you look at medical attention, that's what we're looking at. The criminal activity is the ailment, and how do we address that ailment? Lastly, really I want to provide the good, the bad, and the ugly as it relates to evidence-based practice and the use of risk needs assessment. Really, the good is we're able to target those criminogenic needs that are associated, as what research says, is to reduce reoffending behavior. It allows us to identify dosage, contact requirements, how we go about seeing those individuals. For example, a low-risk offender, you're not going to spend too much time. They typically come into the office once every 3 months. Where moderate and high-risk offenders, we have contact requirements for them in the community. It helps with court recommendation. It allows us to reduce recidivism if the programming is implemented accurately. And really what's important and a key objective is reduce prison population. And that is something I can tell you in Dauphin County we've been easily been able to do in Dauphin County in the last 5 years. Now, the bad, it does require a lot of time to implement. From implementing stage 1 of implementation to stage 4, typically it will take anywhere from minimum up to 5 years. Most jurisdictions, it takes about 7 years to implement all the key stages of evidence-based practices. Training, lots of training that is associated with it, and of course the dollar, the cost. The cost is very, very expensive to implement these programs. That's why we're glad to have Catherine, who's able to apply for a lot of grants to help us with that, as well as the great collaboration of our county commissioners and the court. We're working, and they're all very knowledgeable about evidence-based practice, and they have supported the funding to help move our practices along. But really a key is the collaboration with key stakeholders. Stakeholders like you participating on this call. I mean, that's really, really essential, is that we educate our key stakeholders. That's why you're participating, and build that that village of resources and knowledge so we can help our offenders. Maintaining fidelity, that's crucial. We need to see if it's working. Fidelity really requires a lot of booster trainings, integrated reliability. Again, that's more of a technical terms on how we assess our risk needs assessments, make sure they're being done correctly. Data collection, which our quality assurance has done a great job with, that helps us find out if it is working and where we need improvement. The court process. The court process, that's really a struggle with evidence-based practice in the adult system. When you have plea cases, all the large dockets, as Catherine talked about, 7,000 dockets going, across the court last year. So sometimes, we're asking the court to slow down a little bit, allow us use our pre-sentence investigation reports where we're utilizing the ORAS risk needs assessment to guide the court with appropriate recommendations. And then the bad, as I talked about, is the available programming that's available within our communities to help with risk reduction. The ugly, unfortunately, is the organizational readiness. I will tell you, almost every organization that implements evidence-based practice, it's a rough go. You have to have buy-in, you have philosophical views on how some believe the criminal justice system should proceed. So really it takes your organization a lot of buy-in. So you're going to get that next to that staff resistance, and you have to be able to work with that. And then I talked about stakeholder buy-in. That's very tough. Just as much as your staff, stakeholder buy-in, educating them on why we're doing what we're doing, because it is a paradigm shift in what we traditionally have done in the criminal justice system. And then the financial stability, and that's a really key factor is, again, having the financial resources. I just want to end with this when it comes to evidence-based practices. Some will say EBP is viewed as soft on crime. And I say it's definitely quite the opposite. It really provides more assurance that professionals are using the right strategies and approaches, resulting in reduced misconduct and enhanced safety for all. But more importantly, requiring an offender to confront and change behaviors is more intimidating and harsh than allowing the offender to do time or coast through the traditional community supervision. And that's it for my portion. I guess I'm going to go on the Ohio risk assessment real quick. I'm going to make a couple comments of that, and I'll have Meredith, talk a little bit more about that. What is the ORAS? Well, the ORAS is the Ohio Risk Assessment System out of the University of Cincinnati. It's been validated twice. It really originated in 2006. I think it really kicked off in 2008 or 9, if I'm correct. And that's where it originates. It's a 4th generation tool, which is very, very effective because it's based on the most recent research. There's all, 1st generation, 2nd, 3rd, and 4th generation, and it's all based on empirical research, more comprehensive approach to scientific research as it's used, and it helps us develop a case plan. So why was it selected? Well, one of the reasons we selected it in Dauphin County was it had a suite of assessments. It had everything from pretrial assessment to a prison intake assessment to a reentry assessment to the community supervision assessment. So we were able to use this assessment across, the programs within the system from front end to the back end, and the individuals, the professionals within those programs to use to help guide with case planning and effective risk reduction strategies. Also, it wound up being one of the tools. I chair the statewide evidence-based practice assessment committee for the Adult Chiefs Association. One of the things that was nice about it is that that tool was selected as one of 3 to be implemented throughout the state where you receive funding for. So we were very happy that the ORAS was selected as one of those key assessments. With that said, I'll turn it over to Meredith to continue that conversation on the ORAS.
So basically, as Chad said, we selected the ORAS. Here at Probation Services, we complete the community supervision tool with individuals. I know the Dauphin County Work Release Center does the supplemental re-entry tool with individuals, and then they share that information with us. The prison does the prison tool there with them, and they also do share that with us for case planning purposes so that we're able to see what programs they did have while they were incarcerated. Same thing with work release, we're able to see what goes on, and that helps us to have a continuum with them so we know while they were incarcerated, this is what they got. So when they come out, we can know that that's completed, and we can focus on other things with this individual, such as maybe housing. Now that we have the substance abuse under control now, we can work on some cognitive things with them. Some things that we've learned so far that are normal reporting out, such as, most people are educated that are on supervision with us. Most people do have employment. There is means of employment. I'm not really sure how COVID is going to impact us, because we were set to go a certain course in a certain way at probation as far as programming. Now with COVID, we are now starting to see an individual that was previously employed that is now becoming a point of contention and issue. It's affecting their financial status. That is something that we're also looking at. So we're talking with University of Cincinnati because, you know, we are in uncharted territories right now. So we're doing the best that we can to move forward. I suspect when I run some statistics for this year, things are going to definitely be a lot different than what they have in years past. We're still working on our recidivism study. We do that each year, and we're evaluating that. That lets us know where we need to put our POs at, what more or less POs that we need to have. So I think that's all about I have. As far as the ORAS, we're really looking forward to doing the motivational interviewing so that we can get some better case planning occurring. Does anybody have any questions?
Okay, then, and also just as a reminder, thank you, obviously, Chad and Meredith, but just as a reminder, please do put your questions in the chat. So, you know, summarizing all of this, there's been a lot of information kind of, you know, reviewed today. We've talked about what the CJAB is, what the CJAB reentry subcommittees are, how they're organized. We've looked at some major changes in our system over the past really 5 years, and especially over the last 3 or so years at the front end of the system. We've done a lot of work in that area. We got an overview of what it means in doing that work as part of being an evidence-based system, what that means, and then how risk assessments are part of that for us, how that helps us work with populations that we've identified, and determine better what they might need as they come through the justice system. So all of those things come together into kind of our next steps, which are making sure that everyone in our community uses an evidence-based approach as the foundation for their work. So what do I mean by that? I mean that if you have a program that works with someone who is in the justice system and you say, our program will prevent this person from cycling back through the system, and this is how we'll do that. We're going to work with that person on developing life skills because that's a need area. That's something this person needs to work on. And if they improve these life skills, they're less likely to come back into the system. Then what we can do together is say, great, you're an identified provider of a program that says you'll work on life skills, and you're using a curriculum that has been researched to show that if life skills are improved, this person won't come back. That's great. And so we identify with our providers specifically, trying to find out what programs and practices they're using. And if you're simply a member of the community who is interested in the justice system in general, attending webinars like this is a great place to start. Sending us questions, things you'd like to know. We're doing I think trying to take some new approaches and how we get the word out about some of the work that we do. The reentry subcommittee, I didn't say this at the beginning, but our subcommittee started about 5 years ago. And it really was an internal look to reorganize this work, engage in that evidence-based process and reorganizational process as Chad Libby said earlier, and then bring in these assessments and reorganize structurally around what that means. So these are the kinds of things that do take time, and we still need to make sure that we're engaged with folks in the community, that we're talking with our providers, finding out what they need, and also making sure they know what our population looks like. Meredith could probably correct me later in maybe a round robin or when we have questions. I believe some of the statistics we found that in Dauphin County, more of our offenders come out at moderate risk, meaning they are more likely to come back than is the national average. So that is something that we can adjust, and we have to adjust with our providers and with our officers, understanding that we may need more programs that focus on ways to address criminal thinking and those sorts of behaviors, than maybe another department would or another county would. So that is something that we're more aware of now, because we have some of this information from the assessments. We've done some of the structural reorganizing. We're identifying folks even earlier for treatment and other related needs. So it really sort of does wrap around. I think I saw something come through the chat here, so let me just take a look.
Yeah, Catherine, it's Chad. Yeah, a question from Darlene: is the cost to reentrance of probation considered in ordering treatment? And the answer to that is no. And my whole kind of spiel about EVP is we are very fortunate with the support of our county commissioners and the court to have some programming where it's really not grant funded at all. It's really out of the general budget, provided for risk reduction for moderate and high risk offenders. But my whole point is, these programs are costly because they are providing, evidence-based programming and due to the training to maintain fidelity and the quality of services, the per diem rates are typically a little higher. But by the end of the day, you get your bang for your buck, and so the simple answer is no. It's not impacted by what is ordered for treatment.
Yeah, and I can also say to that, if I could get the question to appear, having a bit of a technical difficulty moment. In terms of costs for treatment, if someone comes in to say a drug or a vet court program, at least we do make sure that any treatments assessed there we're able to pay for. But as Chad said, sometimes it does fall back on that person. That's actually one of the benefits of going into one of those court programs. We will do everything we can to remove those barriers, take those costs off. It does, for both of those programs, they are considered voluntary. So the person does have to say they want to take part, and they have to be screened as an appropriate individual to come into the program. That's by need and by review by the team for each client. And we do take individuals with very complex, long histories in our county into those programs. So they are the most likely to need that kind of structure. So yes, I hope that answered some of that question. Any other questions so far? Again, this is a lot of information. Okay, well, if you have them, if you think of them, or want us to discuss something even further, just let us know. I'm going to throw up the webinars again that we have planned. Again, these were initially selected by folks in the community. Dates may be subject to change. We're going to try to keep it as close as we can to the schedule. The only time one might change is if maybe a presenter has a conflict and we can't otherwise accommodate or work that out. But this is the planned schedule, and you'll get a really deep dive if you like the evidence-based practices, you want to hear more about what risk needs are and delve more into that, about how it matters to the justice system. Chad's going to be doing one of these webinars more in depth on March 18th. So you'll be able to see a little bit more in depth on that subject. And I would say then, if there are no further questions, or even if there are, this is my contact information. Email is probably best. I usually check it daily. And again, obviously we've recorded throughout, so we'll be posting this up at a later date so you can access these slides. If you think of something, if you want to hear more and say, hey, those topics look great, we want to focus on some other things, let us know that. That's why we're doing these. We want to make sure that folks have their questions answered. And you can see that we as county and court staff are here working for our community and to improve the system as a whole, and make sure that we operate with integrity. That's our job. So I don't know if Chad or Meredith have anything to wrap up, or if there are any other questions.
I just want to say, I want to thank the participants for participating in our first webinar, and thank you for being patient as we kind of did exceed our hour time limit, or recommended time, but I thank you. And I also want to thank my colleagues, Catherine and Meredith, for joining me for this really important seminar, and we hope to see you in future ones. I will say, Dauphin County, I take a lot of pride, and I'm very honored to be the director. We are one of the leading counties in the Commonwealth as it relates to a lot of these progressive initiatives around evidence-based practices and some of our specialty initiatives. So thank you.
So there's a question here, Catherine. Can you hear me?
Yes, I can hear you, and I got my chat up so I can see it again.
Okay, so if a person has been incarcerated for 2 years prior to being released due to found innocent at trial, what resources are available for that person?
If I'm reading that question correctly, I think they're asking for if someone is held in jail in pretrial detention because of an alleged offense, and then the person goes to trial and they are found not guilty, what can be done for that individual? That's, as a system-wide approach, I think that goes case by case what would ultimately result. If the person is found not guilty, they would have no further obligation to our system, I believe. Now, in terms of what maybe support that person would need, resources from that aspect in terms of reintegrating, because that is, quite an intense experience to go through if someone has, been alleged to have committed an offense, spend time pre-trial, be found not guilty. The county human services, I think, and other human services agencies would be available to support. I mean, the person would have to seek them out, but there are general supportive resources that are available. The criminal justice system at that point, I don't believe would be involved. Chad or Meredith, correct me?
No, they wouldn't be involved, but I know the prison does offer handouts of places where that individual could go for, let's say, some counseling, due to being incarcerated for that period of time, maybe some housing. They also hand out 211 help books, so that can help with housing. And also there are counselors there at the prison. So if that individual is worried about something, we can obviously connect them with our human services department and see what we can do for them.
Yeah, and just to add, like Meredith said, the 211 resource handbook is on the county website as well. That provides all the available resources from counseling to jobs, skills development, and substance abuse, all those type of things. But as Catherine said too, the county human services department could also be of assistance.
It's the very layered question, very good question.
Yes.
Yeah. Well, okay, with that, if there's nothing else, again, if you think of something, please email us, and we'll work with IT to get this posted as soon as we can. And thank you everybody for coming today. Have a good day.
Thank you.
Yep.